I have a big thing, man.
No.
Extremely true. What would it be like for the family? How much would it cost you to get paid to pay for chemotherapy? It's over 95%. No, I'm talking about
From move-on members from across the country that are experiencing significant problems because of the lack of health care. These lovely people have volunteered to read some of these stories for us. Patrick.
This story, can everyone hear me?
Yes.
Okay. This story comes from David in Chicago. My grandfather, who passed away recently, needed physical therapy to save his life from amputation due to diabetes. The insurance company would only pay for it in blocks of time, so he would have therapy for a designated number of days, then would be forced to leave the rehabilitation center for several days, and then could return to the rehab center to resume the therapy. The therapy was rendered ineffective by this on-again, off-again care. He developed gangrene, but refused to lose his leg. In the end, he lost the battle and his life, and he had insurance.
So I was going to read Lauren's story from Tulsa, Oklahoma, but I'm going to tell my own family story.
Speak up.
3 years ago, my dad died from pulmonary fibrosis. It's a lung condition where the lungs scar. Not a lot of people know what caused it or how it happens. They think it's like rheumatoid arthritis. It's a progressive condition. So he was going to have a lung transplant, and he was going to go to a hospital in New York City that wasn't covered by our health care because it was one of the only hospitals that would do the transplant. And we're going to have to pay something like $250,000. We thought we were going to lose our house. All kinds of other stuff. But he ended up passing away before he got the transplant. So 2 months after he passed away, our health insurance called us and said that there was a hospital that would do the transplant and that they were covered by our health insurance. After her. My story.
I have several little things on this piece of paper. Nicholas is 25, has chronic colitis, and cannot get health insurance because of his prior condition. Marilee has congestive heart failure and does not currently have health care insurance, so her condition is going untreated. Bart has no health insurance and can't afford the important dental and diagnostic care he needs. Gina has lupus and works for a company that can't afford health insurance for its workers. Tara works as a nurse for a home health agency that does not offer insurance, and she can't find a job that does offer it. Cindy is 62, can't afford health care, and is not old enough for Medicare. Ian is 20, has type 1 diabetes, and has been denied health insurance by Medicaid, insurance companies, and Medicare/Social Security. Alexander lost his health care due to high premiums and now has MS.
I have a story that happened a long time ago. My mother was diagnosed with Parkinson's disease. This is going back about 35, 40 years ago. Simultaneously, Morris County decided, she was a psychologist, a child psychologist, and she worked for the county. They decided to privatize their county psychologist's office, and in doing so, she lost her job. When she went to get health insurance, because she had a pre-existing disease, they would not cover Parkinson's disease. My parents spent an extraordinary amount of money out of pocket. My mother had this disease for 30 years before she died, because health insurance wouldn't cover it.
I have a real quick one. This week I had a patient who has a family history of colon cancer. And colon cancer is one of the only cancers that we can actually prevent. And the indication is for somebody with a family history is to have a colonoscopy at age 40 or 10 years before the index case. Her insurance company would not pay for her colonoscopy because she had, they called it a pre-existing condition, that she had irritable bowel syndrome in the past. So she's not able to get this with her present insurance. I run into these kinds of things all of the time.
Thank you. I'd like to tell a story, my own personal experience. My name's Sue, and I'm a lawyer. Half of all personal bankruptcies in this country are related to medical bills. And last year I helped somebody file for bankruptcy, somebody who's worked all her life. She came down with breast cancer, and despite having surgery, she only took off 2 weeks because she knew she had to get back to work and pay the bills. She fell behind in her mortgage payments. Her son had a bicycle accident where he needed surgery. Her daughter was pregnant. Before she knew it, she had $200,000 in medical bills. And while the bankruptcy took care of her medical bills, she lost her house, and she still has no health insurance.
Everyone here is one healthcare crisis away from bankruptcy.
Hi everyone, my name is Rick. I'm a MoveOn member, C4C member, Organizing for America member. Thanks a lot for coming out tonight to Vigil. This is one of over 340 that have been set up across the country. We can't afford to wait. Vigils around the country happening right now. Tens of thousands of Americans are taking action today because we're at an incredibly crucial moment in the fight for real health care reform. We're also gathered at a moment of profound sadness for all Americans in the wake of Senator Ted Kennedy's passing last week. Almost 40 years ago, he introduced the first bill to provide health care for all Americans. This year, he introduced his last. So tonight, let us remember Senator Kennedy's powerful words about the need for real health care reform. Tonight, we continue Senator Kennedy's lifelong mission. Our message to Congress is this: millions of people, our family members, neighbors, co-workers, friends, and many of us are suffering from current broken healthcare system. This debate is about real people. We can't afford to wait any longer for health care with real public health insurance options. Okay? Thank you very, very much for coming out tonight. We can still do more. We can always do protests. There's going to be other events. I'd like everybody that wants to be a part of us to come out again. That wasn't scheduled.